So today we're here with Heather Dean. I'm really excited to hear a bit more about your career path. So just to start off, could you briefly introduce yourself and your current work?
Sure. My name is Dr. Heather Dean. I currently work at the Food and Drug Administration in the Center for Devices and Radiological Health, and specifically I lead a team currently called the Acute Injury Devices Team, and it's a team that reviews devices that are mostly used for mobility, things like wheelchairs, powered exoskeleton devices, advanced prosthetics. I joined this team mostly because I'm interested in the brain-computer interface devices, so allowing someone who, say, can't otherwise move to control a prosthetic device or a computer or a wheelchair.
Great, makes a lot of sense. So moving into the future, what do you see as the most important issues in your field right now? Where do you think that we're going in the future?
I'm excited to see the growth in the brain-computer interface type devices. I definitely think that that is growing. A number of the projects from the DARPA, from the Defense Advanced Research Projects Agency, have funded various studies into new devices that are involved in, say, restoring sensation if you have a prosthetic, or allowing someone to control that prosthetic, or things like that, or dealing with spinal cord injury. Or now there's a program that is looking at non-invasive neural devices that will allow someone to, say, control a drone by thinking about it or receive feedback. So partly because of that funding, and also the funding that the NIH is spending as part of the BRAIN initiative, the BRAIN Research through Advancing Innovative Neurotechnology. All of that is leading to advances that eventually become medical devices. So anything that has a medical purpose that is intended to help anyone medically, or that's introducing energy into the body that we would be concerned about, we need to see those. And so that is adding more and more to our work. I have the feeling that eventually we might have enough of that work to be a team that does only that, instead of the wheelchairs and powered exoskeletons and other devices as well. And that's what I'm most excited about. I want to see more really interesting neurotechnology out there to help people.
So as we wrap up, I know there's been a lot of advice sprinkled throughout this interview, but I'm wondering if you have any parting advice for someone who is in the early stages of graduate school or even before that and wants to go into a similar path.
Oh, yes. Many, many different things. So I mentioned a couple of times throughout the importance of networking, and I cannot say enough about that. The networking is really, I think, almost critical to advancing in your career. So I wound up with my postdoc because I was friendly. I went to say congratulations to someone I sort of knew from Caltech. That kind of thing led to my postdoc. That kind of thing led to my job at FDA. When I became a AAAS policy fellow, I wanted to learn more about what was going on in neuroscience in government. And they actually really encouraged the fellows to network. They encouraged us to have happy hours. And I'm not a big drinker. I'm not crazy about crowded, loud places. I was more interested in focused networking. And so I started this group with a speaker series, and every other week I would have someone come out and talk from DARPA or IARPA or NIH or the White House or various groups, lobbyists, anyone who was involved in neuroscience and neuroscience policy. I would have them come and speak to the group, and I became known in Washington as someone who was interested in neuroscience policy. And this was key when I started looking for a job. And in fact, I happened to be just at an interesting scientific meeting in DC, I think at the Institute of Medicine, and I ran into the person who had been the second speaker, when I started the series. And when he found out I was on the job market, he said, come to an informational interview at FDA. And again, I really didn't know anything about what FDA did. I thought at the time I would go to NIH or DARPA, and I went out really kind of to humor my friend Carlos and actually really hit it off with the people that were there and enjoyed what I learned. and wound up at FDA, obviously. Interestingly, just before I started at FDA, because of another networking event, I got an offer for an even higher paying job with the Office of Naval Research. I had been at just a random scientific event that was kind of part social, just for fun. And at the in Washington, D.C., everything has a happy hour. And so this one had a reception, and I happened to chat with someone who turned out to be a neuroscientist who was in charge of funding in Europe for the Navy in neuroscience. And so she said, oh, you have to meet my friend Tom over at ONR. And so I went a month later to go chat with him, and we hit it off, and he wanted to hire me. And then soon after that, a position opened up for a program officer, and he was able to pull some strings and get an offer to me. And I decided to go with FDA, obviously, but it goes to show just how important that networking can be. So I tell everyone, be open to informational interviews and make these happen. So if you meet someone who has a really interesting career path, or even if there's someone you look up that they're doing something interesting that you think you might want to do, contact them. Say, do you have 30 minutes or an hour to just chat about how you got to be where you are? It's an interview that has no expectation of a job or anything like that. It's just a chance to learn. And people like to talk about themselves. So it's easier to get these than you might think. And it's also a chance to talk about your own interests. I always tell people in an informational interview, spend at least the last few minutes, talking about your own interests and where you want to go, and say, now that you know a little bit about what I'm interested in, can you think of one or two other people I should be talking to? Give someone your information, get their information, and follow up.
Great advice. Well, thank you so much for sharing your career path with us.
Absolutely. I'm happy to.